rheumatologist and also a clinical epidemiologist. And I got trained in Spain and United States. I've been working in the epidemiology of rheumatic diseases for over 30 years. And I've been involved in many interesting places that have some things to do with rheumatic and musculoskeletal diseases. For instance, I've worked in the Spanish Medicines Agency, where I was able to have a say in some of the new products at that time. And I've been also working in health associations like the Patients Association in Spain and the health professionals in Spain. And I was also involved in the strategy of RMDs in Spain. EULAR goals is to become a global leader in RMDs. So advocacy needs to help EULAR in becoming this global leader. And we are helping them with reinforcing their leadership within RMDs in Europe, but also with beyond the limits of RMDs and beyond Europe. So our committee is devoted to finding all the necessary relationships outside rheumatology, say with big alliances like Biomed Alliance, and also with European agencies like the European Medicines Agency or the European Agency for Safety and Occupational Health. At the committee, we create and develop all the narratives that are needed for EULAR and for people with RMDs and for all the professionals behind that to become more visible and to become useful and needed for all the policies. EULAR vision for this new strategy is actually to imagine a world in which RMDs are prevented and cured, and we carry that vision all over. So wherever we go, we carry that vision with us. We are trying to push forward any legislation that empowers the patients or that improves the access to research in RMDs. And of course, we are making allies in all the places and in all the different societies in which RMDs are needed. For instance, we are working a lot on the Non-Communicable Disease initiative, in which RMDs were not mentioned, and we are trying to move forward some initiatives in that regard. And also this year, we are studying the EULAR Manifesto, which is carrying three important messages. One is to prevent, early diagnose, and treat. The other will be mitigating the burden of diseases. And the last one will be on improving research, better treatments, and better diagnosis. So this is what we do in advocacy. And I see that we are aiming high, but we are also earning a lot of points in that arena. Advocacy is instrumental in promoting whatever all the other committees are doing. So for instance, if we are reaching very high in research, advocacy needs to tell all this information to the ones who are driving all the policies. If we are getting very good in education, we need to promote all this information to the ones who are taking care of the education at the European level and worldwide as well. So somehow we go out, we reach out to the communities and the committees. We ask them where are their needs and where are their asks, and we build our narratives with all their asks, and with that we go outside and we represent all the committees. So advocacy, it's a little bit like an observer, but also it's the voice of EULAR outside of EULAR. I feel a little bit like Forrest Gump, because I'm always in the right place at the right moment. I don't know why. I feel like I'm very lucky.